Hello everyone, I'm Dr. Sonal Kumta and I'm speaking to you from the Fortis Hospital, Mulund. I'm just remembering Mrs. Veronica who came to me. She has been my antenatal patient, as in she is following with me for pregnancy, and she was a challenging case. One, because her age was more than 37. She had certain medical issues also, certain urological issues also, as well as she had a condition that is Hemoglobin D Trait. So that can be a blood disorder. So with all of this background, she was following with me 9 months for her pregnancy, and at one visit she came with complaints of severe gum bleeding. Now usually we would not expect any kind of bleeding or anything in pregnancy. We would definitely be alarmed. So we got her routine blood test done, and it was shocking to find out that her platelets had dropped down to 4,000. Platelets are very, very important, as we know, to prevent bleeding from our body. So they are one of the first cells that get activated whenever there is any injury, and they are the defense of your body to stop bleeding. Now imagine a situation where a woman is pregnant and her platelets drop to 4,000. So it was quite an alarming situation, and we really had to get our machinery absolutely geared up and very rapid response. We got a hematologist opinion, and mutually we decided that this patient would have to be admitted because of her severe problem. We got all the tests done, and I think the turnaround time for these test results were just in couple of hours, and we started her on the right therapy or the right treatment for such low platelets, which is immunoglobulins, IVIG, where we have to admit the patient in an ICU setup, and then we give these injections, and they are expected to build up the platelets over the next couple of days. Now also understand that she was at around 31 weeks of pregnancy. So that's not the ideal time to deliver a patient. Usually a pregnancy duration would be about 40 weeks. 37 to 40 weeks is when we would like to deliver a patient. So we were far away from the delivery date, so to say, as well as the baby's growth, the baby's maturity was not complete. So we also gave her certain medications, which are steroids, that help in maturity of the baby faster, because we knew that we might have to deliver this patient earlier than her due date. So we wanted to keep her prepared. Luckily, she responded to the IVIG therapy, and her platelets increased to more than 1 lakh, which is kind of a good zone to have. So we mutually decided with the hematologist that we'll give her a benefit of doubt and try to prolong her pregnancy for a couple of weeks more. Intermittently, we would be monitoring her platelets and watching her for any symptoms very, very closely. And as we would have thought, though we were hoping that her platelets would continue to remain above 1 lakh, but as we had thought, 4 weeks down the line, her platelets again dropped. And this time around, we gave her steroid medications, which are oral medications, again used to build up the platelets, and they were working for her, though the response was not as good. And we were buying some more time so that the baby would be fully grown, mature, baby weight would be good, and then we could plan for her delivery process. So at around 37 weeks, we took a decision that now from the baby's point of view, things were all okay, and we decided to deliver her by a cesarean. At this point, her platelet counts were still very, very low, and she had an episode of bleeding also, which triggered, and we had to take our decision to deliver her. And this time her platelet counts were about 48,000, which is also significantly low. So we needed to deliver this patient with a lot of risk. As you can understand, delivery can cause a lot of bleeding, and even a normal woman with absolutely normal parameters can have significant bleeding. Here we were dealing with a patient with significantly low platelets. So we needed to contact our blood bank, we arranged for platelets, and platelets don't stay in your body for very long. So we have to give the platelet at that moment where we are going to deliver this patient. So everything has to be prepared. It has to be a teamwork with the hematologist, with the anesthetist, with the ICU backup, with the blood bank people, with the labs giving us reports time to time, with the sonography doctors, as well as the obstetrician, that is me and my team, and so many people have to be prepared at that one moment where we are delivering. And we always have to explain to the patient, because the patient can bleed very significantly and this can be a threat to life, and we may have to do certain interventions to save the mother's life also. So at times we have to remove the whole uterus, at times we have to tie up the huge vessels that are supplying the uterus. So all this counseling discussion was done with the patient prior to taking the decision for delivery. She was very, very cooperative. She and her husband completely understood what we were talking, and together as a team, along with the platelet transfusion, we decided to deliver her. It was a harrowing task for us. We were under tremendous pressure, but luckily, as we say, God is great, and Veronica was very, very lucky. We did not have any excessive bleeding at the time of surgery. Everything went off beautifully. She delivered a healthy baby. The baby is doing very well. The neonatologist was also kept in the loop, because such babies also have to be tested and found out if their platelets are low and they may require treatment. But luckily for her, her baby did not require any treatment. Veronica also recovered very, very well in her post-operative period. She did beautifully, and I think her strong determination and will also contributed in giving her a very smooth recovery.
Hi, my name is Veronica Yadav. I am 37-year-old female working as a graphic designer. I got pregnant 9 months back, and because I have taken treatment from Fortis Mulund, this was the first place to go because I have a great experience. I took a treatment under Pankaj Maheshwari sir. Now, the moment I reached, I met Sonal Kumta ma'am, and all the necessary checkups were done, and we got to know that I have D trait thalassemia. So another test was done for my husband, and my husband's sides were clear. So we got a good go ahead with the pregnancy. So all the checkups were done regularly, and everything went smooth until the 3rd trimester, where my platelets went down. I went through a lot of tests which need to be done to identify what is the reason of going platelets that down. And like within 3 hours, the team of Haematologist team and the gynecologist team could figure out that I have ITP, and my treatment started 8 o'clock. Like 4 o'clock to 8 o'clock, everything was done under one roof very efficiently, and my treatment started with IVIG. I was there in ICU for 2 days, and I went home with a good more than 1 lakh platelet count. I was 34-week pregnant at that time, and it was necessary to maintain the platelet first and have a proper growth for my baby. So good decisions were taken, and after 3 weeks again my platelet went down. So again I got steroid treatment, and then I finally got admitted in my 37 week for my delivery. Again, it was a challenge from my platelet side. So the kind of professionalism and the kind of knowledge and the kind of handling my case here in Fortis is excellent. All the necessary decisions were taken on the time. My baby got delivered on 9th September safely, having such a high-risk pregnancy case. My delivery went really smooth with the Sonal Kumta ma'am's team and Sanyal sir's team. I did not have excess bleeding. I recovered in 3 days, just like any other C-section. And my baby is healthy. His birth weight was 3.8. So this place, Fortis Mulund, I completely believe in the staff, the nursing staff, the doctors, the way the system works under everything under one roof and well coordinated and well communicated is really impressive. I literally very thankful, and I owe a lot to the doctors and to all the support and for the happy delivery which I had here.